My name's Matt Foulds, and I work at the Department for Education, and I'm joined by Gareth James from the Department of Health. We're going to both give you an update on the SEN reforms. I'll say a little bit about where the bill currently is, and also talk a little bit about some of the wider changes that are happening outside of the legislative changes, and then give you a quick update on the Pathfinder programme, and then I'll hand over to Gareth to say a little bit more about some of the wider changes happening in health. Before we get to that bit, I thought it'd be just kind of worth recapping on what our overall vision is for the reforms, and they're listed there. You'll be familiar with them. So it's that children's needs are picked up early and supports, the right supports put in place quickly and appropriately. That really importantly, staff have the right knowledge, understanding of the children that they're working with. So there's a big emphasis on CPD and initial teacher training within that as well. That parents know what they can expect from their school, that's transparent and that's clear. That aspirations for children and young people are high, and the outcomes for children kind of runs through the education, health and care plan and the local offer. For more complex needs, the EHCP, and greater control for parents in terms of the overall process, so personal budgets, but also the work that you're doing in terms of parent care reforms and being very much involved in that discussion at a strategic level, and your involvement at a strategic level in terms of the services that are provided locally. So, what's already happened? Green Paper published in March 2011. Even before that, there was a call for views, lots of consultation with parents and the sector and professionals. We then, in May 2012, published our Progress and Next Steps document, which outlined the government's overall response to the consultation and how that response would be taken forward. September 2012, we published draft provisions, so a draft bill, if you like, which was scrutinised by the Education Select Committee. And then in February this year, we the government published its response to the Select Committee's scrutiny of the draft reforms, and we published the Children and Families Bill. So that's where we are right now. Some of the key heights of the legislation. The top thing I think is really important, and that's a change from the reforms as we were publishing in September. That right at the start of the bill, it talks about the importance of the involvement of parents and young people, that they're at the heart of the process. There's new requirements on local authorities, health providers and social care to commission services jointly. The local authorities are under duty to publish a local offer. I'll say a little bit more about that. There's a more streamlined process which integrates education, health and care. The new education, health and care plan running up to 25, so that's replacing the current statementing process and the LD assessment, so bringing it all together into one process. That families have the option of a personal budget to give them more control about the services that they use and how they use them, but it's an option. Parents do not have to take it if they don't think it's something they want to do. New protections for young people 16 to 25 in FE, so a big change in the way that post-16 education works, and it being a part of a continuous process. And that academies, free schools, FE and sixth form colleges are all under the same duties as maintained schools. We also made a number of changes to the bill as it was published from when they were published in draft. So I've spoken about that overarching involvement of children and young people. There are also changes around mediation. So we heard very strongly that compulsory mediation wasn't recommended by the committee, and the government acted on that. So it's now an arrangement to consider mediation rather than having to go to compulsory mediation. And that doesn't delay in any way the timescales of going to a tribunal. The local offer, much stronger in terms of the involvement of children and young people in reviewing the local offer, and that local authorities will have to publish comments that they receive from parents and young people about the local offer and about the services provided. And they'll also have to say what they're going to do as a result of the comments that they've received from parents and young people. And again, very much a strong focus on consulting parent carers and young people when reviewing provision. In health, Gareth will probably talk more about the health duty, but there's an amendment to the bill which was published last week, which will mean that CCGs and the NHS Commissioning Board will have a duty to provide the services that are laid out in an education, health and care plan. The code of practice, so the guidance that schools, professionals, local authorities and other services will work from, will be approved by Parliament, but by negative resolution. So the reason for that is that the code of practice we currently have was last updated in 2001, and that needs to be approved by Parliament to vote, say, if they agree with the changes that have been made. Negative resolution means that the code of practice can be published and laid before Parliament, and if parliamentarians choose to debate what's in the code of practice or to kind of take a vote, they can do, but if no one requests that, then it moves it forward and means that the whole process works a lot more kind of quickly. So the option is there to have that discussion. And post-16, changes around inclusion of children and young people on apprenticeships, been maintaining a plan, and a much stronger emphasis around young offending teams in the cooperation duties. This is a quite complex slide, but it's just really to say a little bit about how the process works in terms of the bill passing through the Commons and into the Lords. We've done the first reading. The first reading was when Edward Timpson went to Parliament and nodded to say that he had a bill. So it didn't take a long time to read it. The second reading is when the bill is kind of first really debated proper in Parliament. So we had that on the 25th of February, and we're now into the committee stage, which means that experts from the sector have given evidence to say what they think of the bill, what they think of wider reforms, and the Minister gave evidence at that committee as well. And we're now going to pass into a kind of a line-by-line analysis of the bill as a whole. So not only the SEN part of the bill, but the other changes as well. And we're currently having amendments tabled to the bill, so this is where changes can be proposed to the bill as it stands on. So that's where we are. We then move into report stage and then into the Lords. So we have some way to go. Very quickly, in terms of what's coming up, we have published in draft an outline of the code of practice, and I'll say a little bit more of that shortly. That then kind of allows more time to discuss the code of practice and the regulations that underpin the reforms. And then we move into a full consultation on the code of practice in late 2013. We then move into spring 2014, Royal Senate the bill, and then looking at implementation. So as I said, we have published a code of practice and draft regulations on Friday last week. So I know from talking to quite a few people that many people have had an opportunity to read the code of practice or to skim through it. And you'll notice that within the code of practice, there's a really strong emphasis on parent participation and parent carer forums, and some of the principles which underpin good participation. And that's been drawn from the work that Contact a Family have done and the work that you've done as forums across the country, and reflected in what the National Parent Carpet Forum have told the department. So hopefully you'll be able to see some of the work that you've done being very much influenced by what's going to go into the code. We've been working with representatives across the sector to develop the code of practice. It's very much a draft. It's being published so that the committee and the sector can see what the kind of content might be of the code of practice. It will be refined further as we learn more from the work of the Pathfinders, and we hear more about the views of you and others to develop a code before it's consulted on proper later this year. We expect the code to be published in spring 2014, and it will cover those areas. So it will cover the whole 0 to 25 spectrum. It will include advice and guidance to health professionals and to social care professionals, as well as those in education. But it's not just the legislation, it's not just the bill that's important. What the Minister's spoken about is a kind of a change in culture, a change in practice. So the work of the Pathfinder is really important, but the work that you're doing in your own forums is very much part of that cultural change. So seeing a much stronger emphasis on kind of working in partnership with local authorities and health providers as part of that wider change. The department's supporting some of that work, not only through the Pathfinders, but also by working with experts in the voluntary community sector, so Contact a Family, for example, in terms of their work on parent participation, but also working with others like the National Development Team for Inclusion on preparation for adulthood and other similar areas. Also, big kind of focus is the kind of improvements to professional development, so the Achievement for All programme being a big part of that. So how schools are prepared, how schools work differently with parents. The Achievement for All programme has emphasised very strongly a structured conversation with parents to involve them much more up front in the support and help that their child gets in school, but also to make sure that there's a really strong focus on outcomes and that parents are involved in being able to tell professionals, this is where I see my child going to, and how are we going to work in partnership to make that happen. Gareth will talk about the health changes that on the final column of that last slide. Pathfinder programme, making big kind of gains. We've published last week an evaluation report of the work of the Pathfinders, particularly those who have had the first kind of full cycle of the EHCP planning process, and that's on our department website. The work of the Pathfinders themselves have really influenced the bill, so a strong focus on person-centred planning, which has really kind of come from the work that Pathfinders have been doing. And we've also set a new clause involving, which puts provision in place to involve children, young people and their parent carers at the heart of legislation, so that's the change I spoke about earlier on. And we are continuing to learn from the Pathfinders and we'll continue to do so. We have on our website an area dedicated to the Pathfinder programme where you'll be able to look at the evaluation report and some of the things that are being learned.